Hi, this is Erica Walda, and I will be submitting the health insurance activity assignment. With research for my insurance, I currently, through my employer, have a PPO or a provider organization plan. My copay for my physician or my PCP is $25. Anytime I see specialist, like an endocrinologist or anything like that, I have a $50 copay. Urgent care, if I were to go, I have a $150 copay. My deductible for the year is $500, which is a really low deductible compared to some people's or previous plans that I've had. I actually chose to look up atorvastatin, a 90-day prescription, 40 milligram for cholesterol medication. So I actually compared it through my personal insurance, and I also compared it through one of the recommendations from Appendix A in the An American Sickness book. Going through that list, I actually chose to use GoodRx. I think that is one that is very common. A lot of people use GoodRx. Not very often can you go to the doctor's office or even the pharmacy and there's like stacks of cards that recommend the GoodRx. I think it's pretty familiar. So when I ran it through my insurance, Blue Cross Blue Shield, the price estimator for my specific plan, the 90-day 40 milligram atorvastatin price was roughly about $5.82 for 90 days, and then the GoodRx had a price of about $26.41. So it is a little bit of a difference. However, I do think that most people tend to use GoodRx when they are uninsured, or sometimes if your medication is either not covered on your insurance plan, whether it's like a formulary issue on your tiers that your prescriptions are covered, but you also run into issues where your insurance, you may not have a low deductible, and those pharmacy costs are going to be a lot higher than a lot of those GoodRx. So I will use a very good example. There are times where in the past, if my employer's changed insurance throughout the years, things of that nature, where some medications may be crazy high. One time specifically that I can remember, so something about me, I am a type 1 diabetic, so I do wear a Dexcom or a CGM on my arm to monitor my blood sugars throughout the day. With that, there was a year where my deductible itself was, I believe it was 5 or 7,000 for the year. It was very high compared to the 500 that I have today. When I went to refill my Dexcom for a 90-day supply, the CVS pharmacy had let me know that for 90 days it was going to be between $1,200 and $1,300 to fill that. That's absolutely crazy. Typically, when I pay for that, when my deductible's lower, lots of times I typically pay about $350 in that ballpark for my 90-day prescription. With this specific insurance that I have as of today, I pay about $250. And then once my deductible was met about halfway through the year, I actually don't pay a single dollar for that. But in years past, going back to my higher deductible days, previously, when they quoted me that $1,200 or $1,300, I was like, no, I cannot afford that every 90 days. So they actually recommended GoodRx, and when I actually pulled it up and I reviewed the GoodRx, they had a coupon to where you could get it for $650 for a 90-day supply. That is not ideal. I did not want to pay $650 for 90 days. However, it is something that I have to have. It's not something that's optional for me. And for me, $650, I really just had to extremely budget and make sure that that was something that I planned and I did budget for. $650 was easier for me to budget than $1,200 or $1,300, for 90 days, 4 times a year. So I will say that these types of resources, like Appendix A has in the book, they are very useful for people. And, there's lots of reasons why people use them, but I think for the majority of the part, consumers will use them if they're uninsured or if they need further assistance because their insurance just doesn't pay or cover it accordingly. Thank you.